So you're welcome back here again. This is the Dr. Bimbo Fade. This lesson is going to be very practical. I want to talk about fertile window and fertility. So I want you to follow me carefully. If you need to take your biro, your pencil, whatsoever to calculate, please do that. Then you need a calendar, either on your phone. You take a big calendar because we are going to be doing some calculation today. So for us to be able to come up with your fertile window, you need to know your menstrual. You need the knowledge of a menstrual cycle, especially the ovulatory phase. Then you'll be able to talk about the fertile window. You'll be able to talk about fertilization. So for your fertile window, it is a function of when sperm and egg is available and they're able to meet. So it's a function of when the sperm and egg is available. So the period between the sperm will be available within the system and the egg will also be available. So the period of these days that the sperm will be waiting for the egg, or the egg will be waiting for the sperm, whatever the case may be. It's what we describe as fertile window, but invariably the sperm is the one to wait for the egg. So this is it. This is the sperm and this is the egg. So this is your ovary. There is a sac within this ovary, the follicle, from which the egg is being released, and it will travel down. It will travel down into the fallopian tube where the sperm and the egg will meet, and fertilization would occur. So we need this, we need both for us to be able to achieve that purpose. And so for you to know your ovulation, when you are ovulating, we need to understand your average cycle range. So when we know your average cycle range, we'll be able to make calculation, we'll make deduction from that. So for most women, the average menstrual cycle is between 28 plus or minus 2 days. So that's 26 to 30 days. For most people, we have a cycle length of 28 days. So I'll take the 3, 28, 29 and 30. It could as well be 26 also. So going with 28 now, if you want to know when you are ovulating, you first of all need to know your average, your cycle, the length, how your menstrual cycle, how long it takes. So if you have 28 days cycle, for any of those cycles, you want to subtract 14 from that particular length. So for instance, if you have 28 days cycle, you want to subtract 14 from that 28. And that means on day 14, that is when you are going to ovulate, all things being equal. If your cycle length is 29, what you want to do is subtract 29 from 14. And that's day 15. So if your cycle length is 30, you want to subtract 30 from 14 from 30, that's 16. So that's what you do for any. What you just need to know is to know your cycle length, how it comes. Sometimes it's good 27, 26, 28, but once it's still within that range, it is okay. So just know that this is what you should have known over a period of time. But if in case you don't know, maybe you have a regular cycle, just wait for about 3-4 months and make some calculations so that you can know the cycle, that length. Possibly look for a reliable app on the internet. But this is, once you know your cycle length, 28 subtract 14, 29 subtract 14, 30 subtract 14, if it's 27 subtract 14. Whatsoever you get, that is the day you ovulate. That's depending on the pattern. Not, this is not day 15 for if you have 29 days of cycle. That doesn't mean day 15. Sorry, that doesn't mean the 15th of that month. What it means is the 15th day from the day you see the first day of your menstruation, the first day you saw your menses. So you are going to count 15 days from that first day. That's going to give you the day when you are ovulating. So now let's do it practically here. Let's say you have a 29-day cycle. The cycle length is 29 days, and you discovered that you started your menses on Wednesday, 3rd of February 2021. So what are you supposed to do? You are going to subtract 14 from 29, as I've previously said. 14 is constant. Once you know your cycle days, your cycle length, subtract 14 for 8, it's going to give you day 15. But you started menstruating on the 3rd of February. So we want to count 15 days from this 3rd of February to know the day you ovulate. So that will be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So that brings us to 18th of February. So, all things being equal, you are going to ovulate on 18th of February. That is the day the egg is being released. And so now, we already know your ovulation. Now, what we need is 3 to 5 days before this particular day. The sperm should be ready within your system to fertilize. So that means sexual intercourse should have happened such that the sperm is waiting for the egg to come so that fertilization can occur. So let's count backwards now. So this will be 1, 2, 3, 4, 5. So that means your fertile period is between 13th to this 18th, even up to 19th, because the egg can survive for up to 48 hours. But typically, it survives for 24 hours. Typically 24 hours. In fact, maybe 12 to 24 hours. It can be up to 48 hours. But we're going to take 24 hours as an average. And we're going to count backward like I did. 1, 2, 3, 4, 5. Now remember, I said 3 to 5 days. So the smarter, if you want to be very smart, I'll count 1, 2, 3. So for me, I'll make sure, if I'm the one, I'll make sure I have sex on the 15th. So that if the sperm does not survive more than 3 days and I ovulate on the 18th, it can still meet it. Or you have sex on the 16th. But you should understand that this is the fertile window. Even extending to 19th, if the egg survived 48 hours. So we can say 1, 2, 3, 4, 5, 6. You can count this as well, 7. But usually 3 to 5 days before the egg is released. So you want to focus on 1, 2, 3. So depending on it. And some of the signs that you're ovulating. Number one, the best sign, the best way to make this prediction is what we have just done now. Some of the signs: thickening cervical mucus, increase in body temperature, and some other stuffs. But this is what we want to focus on. Now, there is a catch here. So that's why you don't need to worry too much on how accurately you can get this. When you know knowing your fertile window is extremely crucial, because outside the fertile window, there is nothing is going to happen. That's when you're going to get pregnant. The sperm must be alive, the egg must be available, then you get pregnant, and that happens within that fertile window. But one thing is, you need to have sex regularly, 2 to 3 times in a week. If you can have sex regularly 2 to 3 times in a week, especially when those days are staggered, 2 to 3 times in a week, then you have a very good chance of getting pregnant, even if you don't know your fertile window, more than the person that knows their fertile window and wants to concentrate only on the fertile window. So that's because so many variables can change, but 2 to 3 days, especially when it is staggered, would definitely work. So if you concentrate on your fertile window, you have 40% chance of getting pregnant, which is a good chance. If you do 2 to 3 days, like I said, regularly, you have up to 90% or more chance of getting pregnant. So you can see that you don't need to really go crazy about this once you are having sex regularly. So having sex regularly is superior. By saying sex regularly at least 2 to 3 times in a week is superior to even the fertile window. All things being equal. Now, all things might not be equal. That's exactly why we are talking about all of this. There are some problems that can happen, such that even if the egg is being released from here, what if there is a problem within this tube? That's when the fallopian tube is blocked. What if that happens? There would not be implantation invariably. There might not even be fertilization, because if the egg is not able to travel into the tube, that's one. Also, there are some other problems that can happen. There can be problem here within the uterus, maybe fibroid, and most of the time this can cause infertility, and this can cause recurrent miscarriage as well, and which will be of concern at the same time. There could be addition, there could be different problems. And we're going to look into all those problems, not in this lesson, but in another lesson, so that we should not focus only on getting a fertile window. What if the fertile window is okay? You already understand the fertile window, you are having sex regularly. Then what could be the problem? Now, there can be a problem with the sperm and ovulatory disorders. So there are quite a number of these problems which we are going to look into. I'm not only going to look into the problem, we are going to see how we are going to structure ourselves and prepare to deal with this problem, whatsoever might be your own challenge, so that you can be able to achieve your goal. Number 2, structural disorders like addiction that I talk about, and so many other things that I'm going to specifically show to you in another lesson, and we're going to deal with the medical conditions. Maybe you are even ovulating, maybe the sperm is good, but one way or the other, you are still not able to take in. So, and this category B is called unexplained infertility. You see that I put it in quotation mark, because usually if there is cases of infertility that we can't explain because we have done all the investigations and everything seems normal, and yet this woman is not getting pregnant, so we say unexplained infertility. But the reason for this program is that most of this problem that is called unexplained infertility can be explained. Possibly there could be some percentage of it that might still be unexplained, as we call it. We want to demystify what is called unexplained infertility and suggest how to deal with it, and you'll see that if your case really falls under this unexplained infertility, there are a lot of explanations to it that we have to look into, and that is medically sound anyway. This is not alternative medicine, such that we can be able to rule this out and understand that it's explainable and fix exactly what is causing the problem. And majority of the women having this infertility or subfertility issue falls under this condition called unexplained infertility. Then talking about these medical conditions as well. So, we have to deal with these medical conditions because typically, once they are present, they are likely precipitant most of the time. And if you go by this medical condition and unexplained infertility, they are responsible for many pregnancies that have occurred that you might not even know you are pregnant. You think you are menstruating. Some of these can even happen. Then you discover that, why is my menses a little irregular? I'm not saying that's what the only thing that is causing it. But it is proven scientifically that many women lost their pregnancy even before they know and they're pregnant. We're going to look into all of this. So we are going to progress into fertility intervention program. So that's going to take care of this in a broad sense, because this is not what you are going to put a quick fix to. So you should get ready to work. You should get ready, and by the grace of God, once we do all of this, we'll be able to take in as expected. So that's it. Thank you for taking your time to follow gradually. I will encourage you to do so to the end. And